Do you find yourself forgetting words or struggling to recall names? These minor lapses might seem harmless, but they could indicate the early stages of cognitive decline. Let's explore what you need to know to safeguard your memory. Memory lapses, such as forgetting common words or misplacing items, are often dismissed as simple signs of aging or stress. However, these seemingly minor issues can be early indicators of cognitive decline, a condition where brain functions like memory, reasoning, and problem-solving gradually diminish. Understanding the link between memory lapses and cognitive decline is crucial for identifying potential risks early and taking preventive action. Cognitive decline can result from a variety of factors. One of the most common is age-related changes in the brain, including the shrinkage of certain regions and reduced communication between neurons. While mild forgetfulness is normal as we grow older, frequent and noticeable memory gaps may signal a deeper issue, such as mild cognitive impairment, MCI. MCI is a transitional stage between normal cognitive aging and more severe conditions like Alzheimer's disease. Another factor contributing to cognitive decline is chronic conditions that affect brain health. Hypertension, diabetes, and sleep disorders, for example, can compromise blood flow and oxygen delivery to the brain, leading to structural and functional damage over time. Additionally, prolonged exposure to high levels of stress can elevate cortisol levels, which has been linked to memory impairments and reduced brain volume in critical areas like the hippocampus. It's essential to recognize that lifestyle choices also play a significant role. A sedentary lifestyle, poor diet, and lack of mental stimulation may accelerate cognitive decline, even in younger individuals. Conversely, engaging in regular physical activity, maintaining a nutrient-rich diet, and challenging the brain with new learning experiences can significantly reduce the risk. Memory lapses should never be ignored, especially if they are becoming more frequent or interfere with daily life. Identifying these changes early offers a better chance of slowing or even preventing further decline. By understanding the connection between memory lapses and cognitive health, individuals can take proactive steps towards safeguarding their mental clarity and overall well-being. While occasional forgetfulness is common, certain memory issues may indicate the early stages of more serious conditions like Alzheimer's disease or other forms of dementia. Recognizing these early signs is critical for timely intervention and management, which can help slow progression and maintain quality of life. One of the earliest red flags is difficulty performing familiar tasks. This might involve struggling to follow a well-known recipe or forgetting the steps to complete a routine activity, like paying bills or managing a calendar. These issues often go beyond typical absent-mindedness and may be accompanied by frequent confusion or disorientation, even in familiar settings. Another concerning symptom is the repeated loss of short-term memory. For instance, someone may forget recent conversations, appointments, or where they placed essential items, despite being reminded multiple times. This differs from simply misplacing keys occasionally. It's the inability to retrace steps or recall events that occurred just hours earlier. Language problems are also an early indicator of serious memory disorders. Individuals may struggle to find the right words, substitute incorrect terms, or pause frequently during conversations as they search for expressions. Over time, this may evolve into difficulty understanding spoken or written language, which can impact communication and relationships. Changes in mood and personality often accompany memory decline. A person may exhibit increased irritability, depression, or withdrawal from social activities they previously enjoyed. In some cases, heightened anxiety about memory problems leads to isolation, exacerbating the cognitive decline. Lastly, impaired judgment and decision-making can signal a deeper cognitive issue. People might make poor financial choices, fall victim to scams, or neglect their personal safety. They may also show decreased attention to hygiene or dress inappropriately for the weather, reflecting a diminished ability to evaluate their surroundings. Identifying these signs early and consulting a healthcare professional can make a significant difference. Early diagnosis enables better treatment options, access to resources, and the opportunity to implement strategies that help maintain independence and cognitive function. Protecting your brain health starts with adopting specific lifestyle habits that support cognitive function and reduce the risk of decline. These habits not only enhance memory and focus but also contribute to overall mental clarity and well-being. One of the most effective strategies is staying physically active. Regular exercise, especially aerobic activities like walking, swimming, or cycling, increases blood flow to the brain, promoting the growth of new neurons and enhancing connections between them. Research shows that physical activity can improve memory and delay age-related cognitive decline. Strength training and balance exercises also play a role by reducing the risk of falls and head injuries, which can impact brain health. Mental stimulation is another critical component. Activities that challenge the brain, such as puzzles, reading, learning a new language, or playing a musical instrument, help build cognitive reserve. This reserve acts as a buffer, allowing the brain to compensate for age-related changes or minor injuries. Social interactions also stimulate the brain, so maintaining an active social life is essential for mental agility. Quality sleep is vital for cognitive health. During deep sleep, the brain clears out toxins including beta-amyloid, a protein linked to Alzheimer's disease. Consistently getting 7 to 9 hours of restful sleep enhances memory consolidation, problem-solving skills, and emotional regulation. Addressing sleep disorders like insomnia or sleep apnea is equally important, as these conditions can impair memory and concentration over time. Managing stress is another powerful tool for protecting brain health. Chronic stress can shrink the hippocampus, the brain's memory center, and elevate cortisol levels, which negatively affect cognitive function. Incorporating stress-reducing practices such as meditation, yoga, or deep breathing exercises into daily routines helps maintain emotional balance and sharpens focus. Lastly, avoiding harmful habits like smoking and excessive alcohol consumption is crucial. Smoking reduces oxygen supply to the brain, while heavy alcohol use can cause long-term damage to memory and executive functions. Prioritizing a balanced lifestyle that includes healthy choices and regular medical checkups creates a strong foundation for long-term brain health. These habits, when consistently practiced, can significantly improve cognitive resilience, keeping your brain sharp and your memory strong as you age. A balanced diet plays a fundamental role in maintaining and enhancing cognitive function. The brain requires specific nutrients to function optimally, and deficiencies in these nutrients can contribute to memory problems, reduced focus, and an increased risk of cognitive decline. By prioritizing brain-friendly foods, you can significantly improve mental clarity and overall brain health. Omega-3 fatty acids are essential for brain function and development. Found in fatty fish like salmon, mackerel, and sardines, as well as in walnuts and flax seeds, omega-3s help build and maintain cell membranes in the brain. They also have anti-inflammatory properties, which may protect against neurodegenerative diseases like Alzheimer's. Studies suggest that a diet rich in omega-3s is linked to better memory and cognitive performance. Antioxidants, particularly from fruits and vegetables, play a crucial role in protecting the brain from oxidative stress, which can damage cells and accelerate aging. Berries such as blueberries and strawberries are packed with flavonoids that have been shown to improve memory and delay cognitive decline. Leafy greens like spinach and kale provide vitamins A, C, and K, along with folate, which supports brain cell repair and reduces the risk of dementia. Complex carbohydrates such as whole grains, oats, and quinoa are important for providing a steady source of energy to the brain. Unlike simple sugars which cause spikes and crashes in blood glucose levels, complex carbs release glucose slowly, ensuring consistent brain function and mental clarity throughout the day. Additionally, certain micronutrients like vitamins B6, B12, and D, as well as minerals like magnesium and zinc, are essential for maintaining cognitive health. Vitamin B12, for example, supports nerve function and the production of neurotransmitters, while vitamin D has been linked to improved memory and mood regulation. Foods like eggs, fortified dairy products, and nuts can help meet these nutritional needs. Finally, staying hydrated is often overlooked but critical for cognitive performance. Even mild dehydration can lead to difficulty concentrating, memory lapses, and fatigue. Drinking plenty of water and incorporating water-rich foods like cucumbers and oranges can support optimal brain function. By making nutrition a cornerstone of your daily routine, you can protect your brain from age-related decline and keep your cognitive abilities sharp for years to come. While occasional forgetfulness is normal, persistent or worsening memory problems may signal a more serious condition that requires professional evaluation. Knowing when to seek medical help is essential for early diagnosis and effective management of underlying causes. One key indicator that it's time to consult a healthcare professional is the frequency and severity of memory lapses. If memory issues are interfering with daily life, such as frequently forgetting appointments, struggling to complete familiar tasks, or repeatedly losing track of conversations, it's important to take action. These symptoms may point to mild cognitive impairment, MCI, or the early stages of dementia, which benefit from early intervention. Additionally, behavioral or personality changes alongside memory problems should not be ignored. Increased irritability, confusion, or withdrawal from social activities can be signs of conditions like depression or anxiety, which may coexist with or exacerbate cognitive decline. In some cases, these changes reflect a deeper neurological issue that needs immediate attention. Family and friends often notice memory issues before the individual does. If loved ones express concern about your forgetfulness, it's wise to take their observations seriously. Sometimes individuals experiencing cognitive decline may lack awareness of their memory problems, a condition known as anosognosia. Seeking a professional evaluation can help clarify the situation and address concerns early. Medical conditions such as thyroid disorders, vitamin deficiencies, and sleep apnea can mimic symptoms of cognitive decline. A healthcare provider can conduct a thorough assessment, including blood tests and imaging studies, to identify or rule out these reversible causes. Treating these conditions promptly can often lead to significant improvement in memory and cognitive function. Lastly, any sudden or rapid decline in memory should be treated as an urgent medical issue. Acute memory loss can result from strokes, infections, or head injuries, and immediate intervention may be required to prevent further damage. Early diagnosis provides the best opportunity for managing memory issues effectively. Whether the underlying cause is treatable or progressive, healthcare professionals can offer tailored strategies, such as cognitive therapy, medications, or lifestyle changes, to help preserve brain health and quality of life.